Well, here we are again. I'm Sheila Younglove, and this is Young Love Live. This week, we're going to go over the topic of COVID-19 pandemic. And I think I've hit something wrong on my screen already. We'll see. Technical difficulties. All right. So, I've got some graphics posted for you to look at, which are courtesy of Robert Trammell out of DeKalb County. Thank you, Robert. I appreciate you providing those that look at the state of Tennessee, and then Davidson County, and then Warren County in one of them. And that's per 100,000 people, the number of cases. And then the other two graphs, one of them was per 100,000 people within our district, and the other one's just raw numbers, actual numbers within our district. And you can see how those numbers spiked right as we started opening things back up. In each one of the graphs, they spiked exponentially. And for right now, in the raw figures, Coffee County's the leader, Warren County, and then Franklin County, and Marion. Sequatchie, Grundy, and Van Buren are far below the others, and that may be because of their location. It may be because people are taking more precautions. I'm not sure, but as you can see from those graphs, it's a very significant jump. So I invite you to really review those and understand, excuse me, I'm about to lose my voice today, where we're coming from when we talk about numbers spiking. You know, the COVID-19 pandemic is unlike anything we've seen in our lifetime. We still have no idea of the long-term side effects. And it's easy to be an armchair quarterback and say, well, the government should have done this or should have done that. It's easy to criticize when you aren't having to make those tough decisions. With all that being said, though, I think we must continue testing on a regular basis and enforce wearing masks outside our home and in gatherings of more than just our immediate family. I'm going to give you some information today from reliable, what I consider to be reliable sources, medical sources, as well as some information that I saw on WKRN the other day that talks about the trend of COVID-19 on pediatric cases. And this was information published by the American Academy of Pediatrics. You may have seen this article. It said that Tennessee leads the U.S. right now in the percentage of COVID cases that are under the age of 18. Dr. Isaac Thompson of Vanderbilt's Children's Hospital made that statement. And according to the report that was published on July 23rd, Tennessee was one of 9 states where COVID-19 pediatric cases exceed 10,000. Unfortunately, Tennessee now has 13,264 pediatric cases, and that makes up 15.7% of total active cases in our state. And the Tennessee data, though, that includes patients that are up to the age of 20. A lot of doctors, local doctors, believe that the majority of the active pediatric cases are adolescents and preteens, and it's probably an exposure and activity type things such as sports, camps, and things like that. And as more people move about the state, the steady rise puts 97% of Tennessee counties near critical outbreak status. A very scary idea for us to consider, and even if you don't believe that COVID-19 is as bad as what people are saying, you know, the statistics aren't lying on this. The American Academy of Pediatrics also indicated that 76 pediatric patients have died throughout the country from COVID-19, and 3 of those were in Tennessee, and they had the majority of the cases had underlying health conditions. So it made things even worse on that child to fight the virus. And the doctors are saying that they just don't know what we're going to do when students return to campus for school. And I saw something interesting about that. Excuse me. There was a survey on WKRN, and as of today at 11:42, 72% of the viewers disagree with Governor Lee's plans to reopen schools. 28% agree with him. Governor Lee appears to be entrenched in his position right now. I'm certainly hoping that can change, and I would think it would if the numbers spike exponentially again. And we have people ask sometimes about, what are we going to do when that happens? Well, the state could extend unemployment benefits for us. Let's talk about some of the most common symptoms that they know right now of COVID-19. The most common ones are fever, dry cough, and tiredness. Less common than that, but still considered coronavirus symptoms, are aches and pains, a sore throat, diarrhea, conjunctivitis, which is pink eye, headache, a loss of taste or smell, a rash on the skin, especially in little kids, or discoloration of fingers or toes. And of course, the serious symptoms on that include difficulty breathing or shortness of breath, chest pain or pressure, and loss of speech, of movement. So please be sure that you seek immediate medical attention if you have those symptoms or any combination of those symptoms. It usually takes 5 to 6 days from when someone is infected for the symptoms to show up, but it can take up to 14 days for it to show up. So that's why they're asking people to quarantine for 14 days if they've been exposed to it. And King's College in London actually came up with a list that they consider to be 6 different types of COVID-19. The first session of those were flu-like with no fever symptoms, where you have a headache, loss of smell, muscle pains, cough, sore throat, chest pain, but no fever. The second type is flu-like with fever. Same thing as the other. Headache, loss of smell, but then also, your cough, your sore throat, hoarseness, fever, and loss of appetite. The third type that they broke down into was gastrointestinal, which includes a headache, loss of smell, loss of appetite, diarrhea, sore throat, chest pain, and no cough. The fourth type is what they consider severe level 1, fatigue. Headache, loss of smell, cough, fever, hoarseness, chest pain, and fatigue. The severe level 2 is called confusion. Headache, loss of smell, loss of appetite, cough, fever, hoarseness, sore throat, chest pain, fatigue, confusion, and muscle pain. And then the most severe level 3 is abdominal and respiratory. Headache, loss of smell, loss of appetite, cough, fever, hoarseness, sore throat, chest pain, fatigue, confusion, muscle pain, shortness of breath, diarrhea, and abdominal pain. And as they learn more, I'm sure that will be updated for us. I was doing some research, and in addition to the information I provided you from Vanderbilt, I looked at the Mayo Clinic's website for symptoms and causes and things of that nature, and I encourage you to go to that website yourself. You can just type in Mayo Clinic coronavirus 2019, and you can see an overview of the virus itself as we know it so far. And it says they had stated that coronaviruses are a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome, and Middle East respiratory syndrome. And in 2019, a new coronavirus was identified, And that's the one we have now, COVID-19, because they found it in 2019. The virus is now known as a severe acute respiratory syndrome coronavirus 2, but the disease it causes is called the coronavirus 2019, COVID-19. In March 2020 was when the World Health Organization declared it to be a pandemic. Public health groups such as the U.S. Centers for Disease Control and Prevention and the World Health Organization are monitoring the pandemic and posting updates on their websites. And they've also issued recommendations for preventing and treating the illness. And I think some of the more unusual ones they talk about are the loss of ability to smell or taste. Everything else kind of imitates flu symptoms, other than abdominal pain or chest pain or that sort of thing. But I think it's very important that we pay attention to these things, because if you normally can smell very well and all of a sudden you find yourself not, go get checked. And those symptoms can range from like very mild to very severe. And some people only have a few of them, others have most of them. I'm looking at some information here that say other conditions may increase the risk of serious illness with COVID. So if you have asthma or liver disease, chronic lung disease such as cystic fibrosis, brain and nervous system conditions, a weakened immune system with bone marrow transplant, HIV, or some medications, type 1 diabetes, and high blood pressure. Now that's not an all-inclusive list. Other underlying medical conditions may increase your risk of serious illness from COVID. So the Mayo Clinic recommends that if you're having any of those issues, and especially if your lips are turning blue or your face is turning blue, get to your doctor as quickly as possible and let them know about your other chronic medical conditions. Let's see, the risk factors. And I think we've known this from the beginning, was people who have been traveling from out of the country and getting in close contact with somebody who has COVID-19 for more than 5 minutes, or being coughed or sneezed on by an infected person. Complications of the disease, of course, we've heard this numerous times, but let's just go one more time, are pneumonia and trouble breathing, organ failure in several of your organs, heart problems, lung problems, blood clots, acute kidney injury, and additional viral and bacterial infections. We don't have a vaccine yet. It's being worked on. It's being worked on quickly. But in the meantime, the Mayo Clinic recommends that you avoid large events and mass gatherings, avoid close contact with about 6 feet of people, with anyone who is sick or has symptoms. Stay home as much as possible and keep distance between yourself and others, especially if you have a higher risk category. And keep in mind that some people may have it and spread it to others without even having any symptoms. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol. Cover your face with a cloth mask in public places such as a grocery store, where it's difficult to sometimes avoid being in close contact. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Throw away the used tissue. Wash your hands right away. A lot of this is just common sense, but amazingly, people forget that, and you have to remind them. Don't share any kind of dishes, glasses, towels, bedding, or other household items with others if you're sick. Avoid touching your eyes, nose, and mouth. Clean and disinfect high-touch surfaces such as doorknobs, light switches, electronics, and counters. Stay home from work, school, and public areas if you're sick, unless you're going to get medical care. And please avoid public transportation, taxis, and ride sharing if you're sick. When we say, well, that's easy to say, but in real practice, what does that mean? Well, we've been on shutdown once and it was difficult, to say the least. People were not wearing the masks that they needed to wear, and we've seen spikes in the virus when we don't wear our masks. And when they started removing some of these conditions on us, you can see from those charts that the cases are spiking right along with it. Teachers are scared. The ones I've talked to are very, very afraid for themselves and their students. And I think that we have to honor that and do our best to find solutions that would work. And I think that the school system is trying to find solutions. It's very difficult to do that. And I'd like to hear some of your comments, some of your ideas. Maybe you know something that nobody else has thought of. And I know that teachers and school principals would certainly welcome your ideas. I've also got information here from the New England Journal of Medicine about reopening primary schools during the pandemic. And of course, for the past 6 months, policymakers and the U.S. public have weighed in against economic factors, health factors, and as fall approaches, attention has turned to the third pillar of the pandemic resilient society, and that's schools. About 40 million children will be entering kindergarten or pre-K through the 8th grade this year. And 27 million of those students are in pre-K through 5th grade. So until school actually starts back, we're not sure what the effect is going to be. In-person schooling matters, and I encourage you to look up this article on the New England Journal of Medicine's website, and it is entitled The Reopening of Primary Schools During the Pandemic. Children miss out on essential academic and social emotional learning, formative relationships with peers and adults, and opportunities to play and other developmental necessities when they're kept at home. Children living in poverty, children of color, English language learners, children with diagnosed disabilities, and young children face especially severe losses. I spoke with some DCS workers the other day, and they said that they've had a great uptick in cases where children are being not taken care of well, they're not being fed, whether it's the parents don't have enough money to feed them, buy groceries and feed them, or they're just ignoring the children. And if you want to keep your children home and homeschool them, there are curriculum online that people can get, and it's very good curriculum. But there are several people within our district who don't even have internet, and they're a 2-income family. So there are no easy answers to that, and I welcome your ideas on that, because it's hard to say, well, one of us will just stay home. Well, you've got to have things like a roof over your head and food on the table, and you can't just dismiss it out of hand. It's very difficult to know what to do on this, and I understand Governor Lee's policy on wanting schools to reopen. I'm just saying that it could create a horrible outcome. The conclusion of the New England Journal of Medicine article said that whether and how we reopen primary schools is not just scientific or a technocratic question. It's also an emotional and moral one. Our sense of responsibility toward children, at the very least, to protect them from the vicissitudes of life, including the poor decision making of adults who allow deadly infections to spiral out of control, is core to our humanity. Our expectations of school personnel are equally emotionally and morally fraught. It's not incidental that the majority of primary school teachers are undercompensated women who are expected to sacrifice themselves for the sake of the children. School closures have also brought social, economic, and racial injustice into sharp relief. With historically marginalized children and families and the educators who serve them suffering the most and being offered the least. For all of those reasons, decisions about reopening schools will remain complex and contested. But there's another aspect to this: mental health. Several people have reported increases in depression, anger. I'm a family law attorney. I've had several people calling me wanting to file for divorce simply because they were at home together constantly during the shutdown and got into fights, and their nerves are frayed. They don't know what to do, and life is uncertain. It's very hard. So I would encourage you, if you've got any sort of feelings of sadness that you just can't explain and just a generally down mood, please speak with your doctor and tell them what you're going through. And if you can get a therapist, see, a lot of them are doing online therapy, and it's great so that you don't have to get out of your home and sacrifice yourself getting the virus, and they are glad to do like Zoom meetings for your therapy sessions. So I think that that's another thing we have to consider. And it's not just the adults, it's also the children. Like the New England Journal of Medicine report stated, there's a lot of things going on that not going back to school will harm the children and their social maturity and ability to interact with others. So there's never an easy answer. But I'm going to look to my campaign manager, Joe, right now and see if we've got some questions, because I can't see your questions.
I don't have any questions, but could you talk about the relationship with the number of uninsured in this district in particular, with the number of hospital beds as cases rise? What do you think the outcome will be, and what can the state do to lessen that?
That was a long question.
It is a long question.
It's a long question.
Just repeat it, Steve.
What can we do? Say it again, Joe.
What can the state do with the number of uninsured in our district?
What can the state do with the number of uninsured in our district?
As the cases rise,
and the hospital beds are not there. What are we going to do with that? Well, I think that this one thing the state can do is, and I said it earlier, can increase, the state can increase the amount that it pays on unemployment benefits for families so that they can afford to get health care. As far as the number of hospital beds is concerned, that one I'm not sure. I really don't know. It's a hard decision, particularly in light of closures of hospitals in small towns. We've had 12 hospital closures since 2010 in Tennessee, and we got 15 more on the chopping block right now. There are no easy answers here, and I would welcome your suggestions on that. Let me see. I had talked to somebody the other day whose wife is a school nurse, and they were doing their in-service training. And I believe the governor had said that they would set up isolation rooms for the children that are suspected of having COVID. And when the nurse went to her training, the school told them they don't have an isolation room. One, much less two. So what are we going to do about that? I mean, are we going to allow the children to stay in the classroom? I mean, that's not sensical.
Dana Mulliken says that after exposure, people are supposed to self-quarantine for 14 days. As a teacher with students, how is that going to be possible? There aren't enough substitute teachers to fill those vacancies every time a teacher has to go in self-quarantine.
Okay. Joe was telling me that Dana Mulliken, a local teacher who is very concerned about her students and everyone else in the town. What happens when the teachers are diagnosed or they have the symptoms and they have to quarantine for up to 14 days? And they, might not have enough substitutes. What are they supposed to do? What if, for example, she says, I get it, and then my husband and my son, she could be out of school for a month, and it's a hard situation. So I think that we have to reinforce to our children and to ourselves to take every precaution we can. And I know little kids don't want to wear those face masks. I know they don't. But we've never faced anything like this in our particular lifetimes. So we've really got to hone in on that with our children. And if anybody is considering being a substitute teacher, then they should get in touch with the school board and let them know, because it may be coming sooner than you think. And the teachers do need to know that they've got somebody there who can teach the students for them, because you can't just have students sitting there with no teacher. So it's a tough, there are no easy answers here, none whatsoever. See, we got any more questions there, Joe?
No, I don't see anything.
Okay.
Do you think that the teacher crisis, the school crisis, with the number of cases will end up closing the schools after they've opened?
The question was, do I think that if the cases go up, could it result in the schools closing? I believe if we have that problem, yes, I think it very much could, and probably very much should. But there again, you're running into the same problems that you've got right now. Not having enough people to watch over the children that are not in school. Some of the daycares are still open. You know, we're still opening while we were on our first shutdown because they were considered essential. As an attorney, I was considered essential, even though I don't go to court every day. This is going to be tough. And prayer that we will get through this is wonderful. But also use every precaution you can. Just be practically obsessive about cleanliness and wearing your mask, not meeting in groups, larger than 10. I know the courtrooms are set up so that people are spaced out at least 6 feet. And that's been very difficult for court to move along smoothly. We're not able to have jury trials right now because what on earth are we going to do with all the people that come in for the jury panels? So hopefully we can come up with more answers as life goes on. But it is a hard place for all of us. And I want you to know that I care about you. And, we've got to be bold. We've got to be bold about making sure that we keep up with what the recommendations are to take care of ourselves. I want you to be brave. This is hard times for everyone. Always be you. But I do want you to consider those things, and I do hear you, and I see you. You matter to me. And I just want us to think about these things. And next week, we'll talk about state licensure. There was a bill introduced by my opponent back in January, but it got quickly tabled to de-license, do away with the requirement for licensure on 27 different professions here in the state. So we're going to talk about that next week. And if you would like to contribute to the campaign, I welcome you to do that. There are links on my Facebook page, and I'm going to have my manager or my field director put up the link on this video so that you can make a secure donation. We need you now, and we've got to change things. We can do things better. COVID-19 is difficult, but there are other things that we can do. So I want you to keep that in mind, and I want you to, please send me your questions. I'll do everything I can to find answers if I don't know the answer. I appreciate you, and I'll say goodbye for now. Oh, and vote for me. Thank you.